Federal aid is on the way to deal with spiking COVID cases here in Clark County.
The state is bringing back more mitigation efforts now as well. Fox 5's Jacqueline Schultz explains the latest from the governor's office.
Well, the governor called on the White House to send surge teams into Nevada. So for the next 2 weeks, federal agents from FEMA are going to be on the ground to aid Nevada with testing and vaccination efforts. And a big reason for concern from the governor's office is, of course, the spike in cases, but also the new hospitalizations. Take a look at some of the metrics here that are concerning health officials. So back on May 31st, 180 Nevadans were in the hospital. Flash forward just several weeks right there. It has increased by 134% to 422 cases in the hospital. Test positivity across the state is 8.2%. In Clark County, it's 13.9%, with across the state an average of 369 daily cases. So this wave of hospitalizations is mostly in southern Nevada. The health district says 95% of people who are checked in do not have the vaccine. Now, some of the reasons for the spread and the spike in cases, state health officials say, are the hot temps. It's driving people to socialize indoors, and people not wearing masks when they're not vaccinated.
Nevadans should continue to make the smartest decisions that they can to protect themselves, their families, their communities, our economy, our state. The list goes on and on and on, and all that we've been talking about for over a year.
Coming up at 4:30, we're going to break down what's going to be done to boost vaccinations as the governor now launches the Vax Nevada Days giveaway, and time is of the essence to curb the rise in cases in COVID-19.
All right, thank you, Jacqueline. And today, Pfizer announced it will seek authorization for a third dose of its COVID-19 vaccine. The company said another shot within 12 months could dramatically boost immunity and maybe help ward off the Delta variant. Pfizer says early data from the company's booster study suggests that people's antibody levels jump 5 to 10-fold after a third dose. And according to the CDC, the Delta variant now makes up more than half of the COVID-19 cases in the U.S. Researchers at Georgetown University say every time the virus spreads, there's a risk of mutations. This is a map showing 5 large clusters of unvaccinated people vulnerable to COVID-19 and potential breeding grounds for new variants.
Up until now, even with the Delta variant, again, the vaccine does protect us, but we never know when the next variant is going to come about against which the vaccine is less effective. And so it puts us at risk not just by exposing us all to Delta, but also by potentially serving as the place where new variants develop.
And the solution, according to health experts, is getting more people vaccinated immediately.